Hello, my name is Fabiana, and today I'm here to provide trach care. One of the indications for tracheostomy would be long-term intubation, and there are no contraindications for tracheostomy. So I'm going to start off by checking the physician's orders, also the patient chart, and I'm also going to check for PPE requirements, and in this case there are no PPE requirements, just the standard precautions. So I'm going to go ahead, wash my hands, and I'm going to put some clean gloves on. Now I'm going to go to my patient's room. Knock knock.
Come in.
Hello, I'm Rubiana. I'm with Respiratory Care, and today I'm here to provide you with some trach care. Can you give me your name, your full name, and date of birth, please? All right. I'm also going to check the wristband, and now I'm going to check the vital signs. So I have a pulse ox which I will use to check the oxygenation throughout the procedure, and I'm going to check for respiratory rate and the heart rate, as well as I'm going to listen to his breath sounds. All right, breath sounds are clear. And I'm going to raise the bed. Are you feeling okay, sir? All right. I'm going to raise the bed so you will be more comfortable throughout the procedure. All right, very good. So now what I'm going to do is I'm going to explain what these pieces are for. So here is the trach collar, and it provides with oxygen, provides the patient with oxygen. Now here we have the dressing, and the dressing helps to keep clean, the surface clean of secretions. This is the face plate, and it helps to keep the trach all together. And this is the outer cannula, and this is the inner cannula. These are the ties that holds everything together. Now what I'm gonna do is I'm going to get my kit that I previously brought it with me, and I'm going to assemble it to start the procedure. Here I have the clean gloves on, so I'm going to take the old dressing out. All right, sir. And I'm going to throw it away. There's a garbage right here. All right. So now what I'm going to do is, using sterile procedure, I'm going to place everything on the right place. So here's the drape, and it's gonna go over the chest of my patient to prevent his clothes from getting dirty. I'm gonna throw away these clean gloves because now I'm going to have to use the sterile gloves. Here, my sterile gloves. So I have my sterile gloves on. I'm going to put some hydrogen peroxide and water solution into my container on my kit, because I will use that later. All right, so I'm going to remove the inner cannula now. We are going to wash it. All right. I hold it with my non-dominant hand, and I'll take a brush dip it in the mixture and I will wash it. I will also clean the inside of it. All right. And I will rinse it with the mixture. All right, now it's all clean and I'm going to put it back. All right, so what I'm going to do now is I'm going to use a clean gauze and I will dip it into the other container that has the clean mixture of hydrogen peroxide and water, and I'm going to wipe around the stoma as well as the faceplate, and now the other side. I will discard this gauze and I'll get a clean one and do the same thing. I will try to clean under the faceplate as I can. All right, everything okay, sir?
Yes.
Now, what I will do is using the Q-tips, I'll try to reach under the faceplate and clean around the stoma. I'll discard, get a clean one, clean on top, discard, get a clean one, dip once again in the water and hydrogen peroxide mixture, clean. Now using the pipe cleaner, I'm going to clean around, I'm going to clean these little spaces on the faceplate. All right. Get a clean one, and I'm going to clean here on the faceplate. All right. Now I'm going to use the new dressing and I'm going to put underneath the faceplate. This will help to keep it clean. And I want to make sure that it's well positioned. So the tips of the dressing have to be touching. That's when we know that it's on the right place. Now that's good. So I also check the ties, and if they are dirty, I have to replace them. In this case, they are clean, so I don't have to replace them. Are you doing all right, sir?
Mm-hmm.
All right, so I'm going to throw the drape away. I'll discard it. And I'm once again going to reassess the patient's vital signs. So oxygenation is good, and the respiratory rate is still normal, heart rate is normal. I'm going to put the oxygen mask back in, and I'm going to listen once again to the breath sounds. All right, it's clear. Now I can throw away my sterile gloves. How are you doing, sir? Is everything going all right?
Mm-hmm.
All right, well, sounds good. I'll be back later to check on you and to do another trach care. Also, if you need suctioning, I'll be coming by to check that. And let me put this back in place. Would you like me to lay down your bed once again?
Mm-hmm.
All right. All right, very good. Thank you, sir. I'll be back later. So now I'll just get everything that's still here, and I'll just discard whatever I didn't use in the tray, and I will take my containers and I'll leave it on the place where they're supposed to go. I'm also going to put this back in place. And also very important, once I leave the room, I'm going to chart what I did and the description of everything I did and vital signs and everything. So that's it for trach care. Thank you.